far the most common injury that we see with golfers is lower back pain. Whether we're talking about amateur golfers or professional golfers, that is by far the most common injury. In terms of our professional golfers, the reasons why they're getting back pain is often due to just overuse. They're just doing so many repetitions of swings every day, day in and day out, that eventually the back just kind of gets tired. For our amateur golfers, a lot of times it's more from bad mechanics. So we see some imbalances or dysfunctions in the body, or we just see some bad golf mechanics that are leading to or contributing to back pain. So one of the first things that I look at that can definitely have a big effect on someone's back is their setup posture. And so when we take our setup posture, what we want to see is that as they hinge from the hips, if we draw a straight line from the top of their back or right below their neck down to their rear end, it's a nice straight line. One of the common bad postures that I see is what we call an S posture, where the back is too arched, or we see more of that S curve as opposed to that straight line. In this posture, in this S posture, the back is really crunched down. The spine's kind of just like this. And so then from there, it can't rotate quite as much versus when it has a little bit more space, it can rotate. The other thing is in that S posture, in that arch posture, our glutes and our abdominals are our core, which we need to help support the spine, and that's where we're also going to get power and stability from in our swing. They're not really activated or turned on quite as much. They're just kind of hanging out, not ready to use. So we've already lost some protection of the spine just from that bad setup posture. The other poor posture that we see is what we call a C posture. And so now the person's a little bit more rounded. We don't see enough of that hip hinge where the rear end's pushed backwards, and it's more of that just full curvature as opposed to that straight line. From here, they've kind of locked themselves down throughout the spine to be able to rotate. So from this initial setup posture, we're going to try to rotate. But when we're in this kind of closed down position here, we simply can't rotate, versus in a nice neutral posture, we can rotate a lot better. And so once that happens, once she's set up a little, or she's rounded too much, then compensations are going to have to occur because she can't rotate through her spine near as well. So she's going to start to do other movements to compensate for that. So the first thing we always look at is posture to make sure we're in a good neutral posture before we even swing. From there, other reasons why I see back pain in terms of golf is one of the more common ones is what we call reverse spine angle. And so if Chloe faces the camera and takes her setup on her backswing, when she turns back, we should see that she's nice loaded over her right side or her trail leg, and that her left shoulder is almost over her right foot there. A lot of times what we see is what we call a reverse spine, where instead of being nice and loaded over her right side, that the torso actually falls back towards the targets. And maybe she has more weight on her left side as opposed to her right side. Oftentimes we would say that right knee kind of straightening out, but we have some tilt or some side bend to the left as opposed to being nice and loaded on her right side. The problem with that is that once we're here on this right side, we've really opened up the spine, or what we call the facet joints, and we've stretched the muscles on her right side. But from here, she's still got to get back down to the ball. So she's going to actually reverse that movement. She's going to side bend to the right. And because it's a downswing, she's going to do it pretty quickly and forcefully. Where those muscles have been overstretched, those facet joints have been opened up, then they just cram down together really forcefully. And a lot of times what it's leading to back pain, particularly right lower back pain. And so when I see people coming in with right-sided low back pain, I start to suspect maybe they've got some sort of reverse spine angle going on in their swing. Finally, in terms of just how the body's built, our body is built kind of in alternating segments of mobility, stability. And what I mean by that is if we start kind of from the ground and we look at the ankle moves in a lot of different planes. It moves up and down, it moves side to side, it moves rotationally. And so we call that a nice mobile joint because it has lots of planes of movement. We move up, we go to the knee, and the knee primarily does flexion and extension. It has a little bit of rotation rotation, a little bit of side bend, but primarily it's just one pattern of motion. And so we call that a more stable joint. We move up to our hips, and our hips are supposed to be mobile. They rotate, they go side to side, they flex and extend. Our lower back, our spine needs to be nice and stable. So our lower back is meant to flex and extend. It doesn't get much rotation. The whole lumbar spine, those 5 segments, only have about 10 degrees total of rotation. So it's much more for flexion extension. Moving up again, our thoracic spine, or our upper back, that really needs to rotate. We need to have a lot of motion through there to flex, extend, side bend, and rotate. So our 2 main points of rotation for golf are our upper back and our hips. Well, a lot of times I see people who maybe they sit all day at their job, or they don't do enough exercise or movement in those planes. They've lost motion at those joints. Maybe they've got some arthritis, so they're lacking some hip rotation. They're lacking some upper back or some thoracic rotation. Maybe they have a little bit of a rounded back posture, but they're still trying to perform that rotary movement with the golf swing. So if our hips can't rotate and our upper back can't rotate, then something's got to have to rotate if we're going to perform that swing. And your body is going to try to get motion wherever it can so that you're able to do that. And so it starts to sacrifice some motion at the lower back. The lumbar spine's meant to be stable. Like we said, there's only about 10 degrees of rotation, so not a lot. But now, because the other segments don't have as much rotation, now we start to force some rotation through the lumbar spine. Eventually, the lumbar spine says, you know what? I don't like that. That's not what I'm meant to do. I'm meant to flex and extend, not rotate. And we start to have some breakdown, and that's when pain starts to occur. And so to really, when we evaluate people, we see, do you have the requisite range of motion at the areas that we need to be mobile, and do we have the requisite stability at the areas that we need to be stable? And if we have any sort of break in that pattern, that's when injury is likely to occur, and that's what we need to start to address and fix. So it could be we see back pain as a result of imbalances in the body. It may be due to poor golf mechanics, or it may be a combination of both.